Area of study is the acute inpatient psychiatric setting. Our problem is related to the prescriptive practices of antibiotics in the acute setting for psychiatric patients with symptom burden and severe and persistent mental illness. We recognize that there is a standardized and best practice model for antibiotic stewardship in the acute medical setting, but there doesn't seem to be any literature based on our integrative review of any studies related to the complications and obstacles in the patients with severe and persistent mental illness and taking antibiotics, medication management, as well as monitoring infection rates and antibiotic rates. The significance of this is there is a disturbance in baseline functionality for this patients related to symptom burden. Oftentimes, they refuse medications. Their lack of hygiene when they are in an exacerbative state often leads to infectious diseases. Also, their environment, their living habits, all contribute to a potential for infection. So when we look at the patient population that we receive here at the hospital, we wanted to understand better the community-acquired infections as well as the hospital-acquired infections, and the relativity of our physical assessment in capturing those infections, as well as the prescription practices by the attending for those infections. So it's an interesting area of study. Our results will come from a retrospective review of the patient population in 2014, actually. That is prior to the implementation of an antibiotic stewardship program. We'll be doing an observational study, and it will be, because our charts are paper format, it will be a data collection tool that has that is a paper format for chart review. Now, this is part of standard practice in our setting in the infection control department, and we will be reporting the information on the data that is captured. We will be de-identifying data as our protocol dictates, as well as maintaining the data according to the data integrity plan here at Eastern State Hospital. The prospective portion of the study will have control and comparison groups, and the prospective portion of the study will allow us to evaluate the antibiotic stewardship program as it evolves as part of standard practice in the management of the prescriptive practices and the documentation of infections at the hospital. We have referenced several studies to evaluate the implications and the necessity of this study. And as I stated, there is relatively no literature regarding the antibiotic stewardship practices for behavioral health. So the data will be new, will be probably establishing cross averages of what the infection rates are and the antibiotic rates are, as well as the implications for a revised antibiotic stewardship program in this setting. We hypothesize that symptom burden and medical necessity, medication management because of the rights to refuse medication during their acute phase of symptom burden, as well as the types of infections we'll see in the hospital-acquired infection rates and the community-acquired infection rates. We can also provide descriptive statistics on patients that present with different types of infections and what those commonly are and what we see in that population. Thank you.